Very good evening, everybody. We have with us an expert dermatologist, trichologist, professor, influencer, Dr. Anil Abraham, live from Abraham Skin and Hair Clinic, Bangalore. Dr. Anil Abraham was the professor and head of dermatology at St. John's Medical College and is now dermatologist and trichologist at Abraham's Skin and Hair Clinic. He has more than 30 years of experience and is considered a guru in the field of hair loss. Welcome, Dr. Anil. A very pleasant good evening to you, sir. It's such a pleasure to have a luminary like you on this platform, Dr. Abraham.
Good evening. Thank you so much for that very generous introduction. I look forward to questions from you and from the audience who are listening in.
First of all, as we are talking about hair loss, a hair loss for us is such a routine thing, but when we can't differentiate, between what's normal and when to be concerned, please enlighten on this.
Scientifically, according to the textbooks, there is a number that is mentioned, which is more than 100 hairs lost per day is considered a significant loss. But I don't think anybody sits and actually counts the number of hairs they're losing every day. So I would go with what the patient says. So when a patient walks into my clinic, sits opposite me and says, "Doctor, for the last few weeks, I've been losing more hair than I normally do," then that is definitely a warning sign, because each of us, when we comb or brush our hair or after a bath, when we look at the drain, we are able to make out that the amount of hair lost is not what we lose normally, which is a couple of hairs usually. Or when you run a brush or a comb through your hair, if a couple of hairs come out, none of us are going to panic. The fact that they've taken the trouble to come and sit in front of a doctor and consult him is because there's already reached the level of being significant hair loss. Some of my patients help me with that, where they'll open their handbag or they'll run their hand through the hair and give me a bunch of hair and say, "This much hair I'm losing every time I touch my head." So the patient is the best critic. The patient is able to make out, compared to before, I'm losing more hair than normal, or it's thinning out significantly. So I take what the patient says very seriously. So the scientific criterion is 100 hairs per day. But even if 20 hairs is abnormal for you, if you feel it's more than usual, then please don't wait for the scientific number of 100. Please consult your doctor so that you can reverse the hair loss change early.
Please tell us, what are the general causes of hair loss?
The general causes of hair loss, and this is why I think there is no one remedy. Sometimes patients come in and tell me, "I've used this particular natural remedy, or I picked up this hair oil from the supermarket and I've been using it for the last 3 months and it hasn't helped my problem." The lacuna in this theory of method of general treatment of hair loss is that you're not looking for the cause, which is the question you asked. What are the common causes of hair loss? When I see patients with hair loss, I would clearly want to differentiate between people who get localized, that is patches of hair loss, and people who get generalized hair loss. That means all over the scalp, generally it is thinning, and there's hair loss from all over the head.
How many times a week should I wash my hair?
Okay, so the answer to your question varies from person to person. Usually after a full consultation for about half an hour, 40 minutes, as the patient gets up to leave, they will stand at the door and then gently open the door and shut it again because they've forgotten to ask how many times to wash their hair. So this is a question that I face repeatedly every single day. I can give you a ballpark number. It's okay to wash your hair every day if you have an active lifestyle. That is, if you're exercising, you're gymming, you're doing something where there is a lot of sweating and you want to wash your hair every day, there is no great harm. Remember, the process of washing the hair is not causing the hair loss.
How to choose a shampoo and a conditioner? I'm sure your patients also come with the same question.
It's not necessary for every normal person with no problems to be going to a trichologist to ask what shampoo to use. Over a period of time, you would have found comfortable shampoos to use, and you would have found that this particular type suits you. So if you're not having any problem, I'm not interfering with your choice. If you have a comfortable shampoo that you like to use, please go ahead.
To know more about hair care in current scenario, watch the full talk show with Dr. Anil Abraham from Bangalore on Hair All Issue Resolved YouTube channel.